Hi viewers, I am Soumya from Erode Secondary Engineering College, Tirupati, Perundurai, Department of Biomedical Engineering. Now I am presenting a topic of stereotactic radiosurgery. It's called SRS. So from radiological equipment, what is mean by stereotactic? It's a orientation in space. So what is a stereotaxis? From Greek, stereo means space plus taxis means arrangement or orientation. So it's a orientation of the space. It defines a particularly point of the body. It's a using of 3D coordination system. So it defines a point in the body using a 3D coordination system fixed to the patient. Ensure precise targeting for treatment. For next, stereotactic radiosurgery. It's a SRS. It's a high precision. It's a single dose radiation therapy focused on the small critical intracranial lesions. In this picture shows the single source of the radiation therapy to particularly point of the target to destroy the tumor cells. History and evaluation. It's developed by more than 50 years ago. It's 1951. It's introduced by Dr. Lars Lexels in Sweden. It's focused on radiation instead of surgery. Designed the Lexel stereotactic frame for precise brain targeting. In 1968, first gamma knife used at Karolinska Hospital, Sweden. Later, Linux-based SRS allowed treatment of tumors beyond the brain. Now widely used for small, precisely located brain and body lesions. So definition of the SRS already tell about single high dose of radiation, the small intracranial target. So designed to destroy tumor cells in one session. Normal tissues are spreaded using deep source gradients. Steep means 90 degrees angles to dose to patient. Principle of the SRS. High dose gives effective tumor cell kill in one fraction. Requires extreme accuracy to avoid damage to nearby healthy tissues. Commonly used for brain tumors and arteriovenous malformations. Goals of SRS. It's a deliver enough dose to eradicate tumor cells. So minimize side effects in nearby normal tissues, preserves cranial nerve functions and cognitive functions. So types of brain stereotactic radiosurgery. It's two types: gamma knife surgery and Linac based. Gamma knife surgery. It's uses of tiny particles of energy called photons. Two methods are used from photons, but gamma photons into the gamma rays, but Linac based it's into photons into the X-rays. So gamma knife surgery uses a tiny particles of energy called photons. With gamma knife surgery, the photons come from gamma rays. The machine points around 200 beams of gamma rays at the treatment area. Gamma knife is often used to treat small to medium-sized tumors, AVMs, and trigeminal neuralgia. It used for only small and middle-sized tumors. So it's a picture of gamma knife surgery. And the second types, it's linear systems, linear accelerators. It's also use photons, but from X-rays. Brand names includes Variant Edge, CyberKnife, and others. Linux system can treat larger tumors, and this system can be used in other parts of the body. Some systems use robotic arms and motion tracking to ensure the radiation stay on the target. So it's a picture of the Linux system. Indications: a small brain metastasis, AV malformation, trigeminal neuralgia, pituitary adenomas, acoustic neuromas. So SRS procedural steps. It's a 5 steps of SRS SRT. It's a common procedural steps. It's a 5 steps. First one is frame fixation to skull. Second one is imaging. Third one is target localization and planning. Fourth one is patient positioning. Fifth one is single dose irradiation delivery. SRS frames. So it's common for SRS and SRT. Rigidly fixed to the skull to keep the head stable during SRS or SRT. Ensures accurate and repeatable targeting of the lesion. Example, axial frame, PRW or CRW, brain lab system. Imaging in SRS. Imaging are used are CT, MRI, angiography, PET. So CT uses in bone structure and patient positioning. MRI used the detailed soft tissue anatomy. Angiography used AVM's visualization. PET are used tumor activity and extent. Next one, treatment planning in SRS. So define a target point and organs at risk. Set dose, arc angles and collimators. Ensure deep dose fall off around the target. Plan verified using dose volume histograms. Delivery and quality control. Single high dose delivery via LINAC, gamma knife or cyber knife. Accuracy within 1 mm. Isocentric beams converge on target from multiple angles. SRS limitations. Not suitable for lesions greater than 4 cm due to toxicity. Avoid near optic or auditory nerves sensitive to greater than 10 GY. Risk of neurotoxicity increases with lesion size or deep locations. Advantages: it's a single treatment session, high tumor control for small lesions, minimal invasiveness. Disadvantages is a risk of normal tissue toxicity near cranial nerves, not suitable for large tumors, limited fractionation options. So summary of SRS, it's a single high dose treatment. It's a best for small intracranial lesions. Freezes target with stereotactic frame and imaging, limited by size and location of tumors. So last one, SRS versus SRT comparison. So feature SRS SRT comparison means doses levels means high. It's a single high dose. It's a multiple small doses. It's a session is a one will be enough. It's a 3 to 5 or more. It's a SRT used. Frames are it's a invasive rigid frame. It's a non-invasive mask. Best for small intracranial lesions and it's a large or critical lesions for SRT. Toxicity it's a higher risk for SRS, lower risk for SRT. Thank you.